Age-related macular degeneration is a disease of the back of the eye that basically gets worse as you get older. That's the main problem with it. You don't get it when you're young, you get it as you age. The main cause of macular degeneration is age. Lifestyle affects the macula, so smoking's not very good for it, alcohol's not very good for it. Exposure to a lot of ultraviolet light is also one of the factors that can be a problem. So when you get macular degeneration, the back of your eye starts to degenerate, so the cones, the bit that you need to see, start to not work properly. And the main symptom you have is loss of central vision. So if you're looking at somebody, you can see their body, you can see around them, but you don't actually get to see the face. The face becomes blurred. That's the main thing. Also, if you're reading a line of print, the word you're looking at is foggy, it's out of focus, whereas the words to either side of it, you can see nice and clearly. So if you look to the side, it's not bad, but it's the straightforward part that is the big issue. Unfortunately, because it's mainly an aging problem, there is not a cure. We can try and reduce it as much as we can. The two main types of macular degeneration are wet and dry. The wet type is the one that we can start to do things with nowadays. It does involve some injections into your eyes. These injections stop this fluid build-up that comes about when your macula starts to degenerate. The other type is the dry type, which unfortunately there is no cure for. It's the one that takes many years to develop, so it can take 10, 15 years before your sight is affected. The best thing you can do for that is just to keep a nice healthy diet. Green leafy vegetables are the best thing because they contain the pigments that you need to protect your eye. The worst case scenario for macular degeneration is that you can go blind in an eye. We can help you because magnifying glasses can help. Magnifying glasses will move the images over a bigger area of your macula, over your retina. The peripheral vision, the side vision, to make you see better. So rather than looking at somebody's face, you look slightly to the side of their face. So when somebody's identified with macular degeneration, we like to see them on a more regular basis. The reasoning behind this is that if it's the wet type, we can catch it much earlier and you can get the treatment started. If it's the dry type, we can then prepare you by dietary changes, by lifestyle changes to slow the progressions down. We have OCT machines that can check how quickly things are progressing. If it's progressing quickly, we can do more. We'll get you back more often. We'll re-scan you. The scans are brilliant because it can tell us if it has changed at all. If there's no change within a year, you're doing the right things. If it's changing very quickly, we'll have to try and look at other interventions to see if we can slow things down for you.